since we are in the AI section of the Global Healthcare Summit, right? So let me make a prediction, the one that I know the most accurate for AI. Majority of you sitting here will be very soon having something called postprandial somnolence. That with the symptom of drowsiness, low energy level, and lack of focus, AKA food coma, or after lunch or after dinner dip. And basically after the lunch, you will experience that. But I know there is one treatment, which is an engaging presentation, will keep you awake. And I will try my best. All right, so I love food. Before we have kids, my wife and I used to drive 5 hours from DC to New York, Chinatown, just for food. And we have kids now, of course, no more this kind of crazy food trip, but every now and then, we will still having dine out. And there is a very popular restaurant. Even though you make reservation online, you still need to wait a long line. And one night, what happened is we wait there, we kept waiting. And until the table is up, the waiter will say,
Peter, table for 4. Susan, table for 5. Cupid, table for 6. Cupid, table for 6.
Cupid, oh, yes, here. Oh, by the way, my name is Cupid, not Cupid.
Whatever, come here, Cupid.
That, I called it English literacy. The fail to read, write, or understand English. It's fine if you cannot really pronounce someone's name, but what about if a person can speak fluent English, understand and know each and every word the doctors tell him, but still not quite easy to get the instruction correctly? And that's, I called it is health literacy. And let's imagine Alex, he needs to take the antibiotics, but he's very busy today. He even skipped breakfast, lunch, and dinner and decided, hey, I just go to the all-you-can-eat buffet to make it up. But since antibiotics, he skipped it. So in the next day, he doubled the dosage and take everything. Oh, what about Lisa? She is a 50-year-old woman and received a letter recommending her to have a mammogram checkup for the breast cancer. But because of the confusing instruction and also missed the purpose and the importance of that letter, she ignored it and thinks, I don't even have the symptom. Why? Why check it? And don't even think health literacy is the problem just for patients. Let's say Dr. Johnson, he is a pediatrician. And with a kid having rare cancer, he received a rare cancer, like a radiologist report, but he could not even comprehend some of the jargon in the letter. So health literacy is not a problem just for patients. And you may wonder, Cupid, which year are you living in? If they don't understand, we have ChatGPT, Gemini, we have a lot of things in AI that they can help, right? Well, AI is a good, very powerful tool, but there is a catch. And the catch is, the reason is, AI is powerful, all start from data. If we have data, we can train a model so that they can understand the problem. And if we have a better model, we can improve the apps and make this app a smarter app. And then the smarter app will empower the user, and then at the end, produce more data. This cycle continue, and it is the ideal data flywheel, and that's why AI is so powerful. Let's imagine something. Why AI is only powerful now? because it fills the gap for the previous revolution could not. In the Industrial Revolution, we democratized the production so that it freed us from the physical labor. And then in the Computer Revolution, we democratized computing or calculation. It frees us up from the mental labor. Now, if we go one step further, internet, we democratize the information so everyone can access the data more freely. Mobile revolution, it's helping the communication, democratize the communication. Now, AI democratize the knowledge. So everyone is a PhD right now. But what are we missing? Are we still missing something that AI cannot fulfill? Well, you know what you know, and you don't know what you don't. AI is the same. Remember, AI is powered by data. It uses the data that it knows in order to train the model. But how much data that an AI model can be trained upon? Most of them are public data. How about some data inside your phone? Proprietary inside the hospital data center. They may not be able to get the access of that data. And not to mention that even if we have that, how are we going to train with that? That's number one. And you may say, hey, no, Hubert, I tried ChatGPT and then it can answer me all the questions that I ask. But before I jump on to the conclusion, let's take a look at this. What do you see? If you see the pattern is moving, you are not alone. You're not alone because, in fact, this is a static image. It doesn't move. You just hallucinated. I said you're not alone because LLM is doing the same. It imagine or it hallucinate something that is not even there. And one of the most recent viral example is, how much rocks shall I eat? And the answer, at least one small rock a day, with a reason. Why should that be? And you're talking about LLM is powerful? Well, and even though some people say, hey, we can put guardrails around those LLM to make sure those kind of problem will not happen. But how much guardrail is good enough? More importantly, the more guardrail we put in place, it defeats the purpose of generative AI. But even so, even if we can put the right amount, the perfect amount of guardrails around LLM, around the AI model, but it's still reactive. You cannot, like every second or every minute, you cannot keep asking the ChatGPT, what should I do now? Or it doesn't even know your status to give you the perfect answer. That's why reactivity or reactive is another problem of the current AI. Not to mention the hardest thing, the most challenging thing is collaborate. Can you, or do you think it's possible for you to ask someone training the chat or the LLM to access their data? Of course, no. It's their proprietary data. Why do they want to give it to you? Because of data privacy. Or if they have the model, can you ask them to give you the secret source of how did they train the model? Because of business interest. So the collaboration is actually not quite possible in the current AI system. So now, those are AI. But what about healthcare? A few years ago, I got diagnosed with hyperthyroidism. Okay, so I think maybe that's the reason why I'm so hyper all the time. But that's not the point. The moment that my primary physician say, hey, Cupid, you need to go to the lab and doing the thyroid scan and do the blood work. You know what happened? Each and every time I go to different places, I need to fill a form. 95% of the information I have already filled it somewhere else because it's not patient-centric. Each and every piece of information, even though it's there, is siloed in different locations. Now, let's imagine a researcher. She has a very great idea to help the hyperthyroidism. And I'm okay with her to use my data. However, because of information blockage, she may not even be able to access as easy as she wants, going through a long process to get on a patient's data for the research. Now, not to mention that, a few weeks later, let's suppose I feel very weak and I gain weight, and a month later, I feel like I really need to go back to the doctor and ask what happened. And then she told me that, hey, Cupid, we are actually overprescribed your dosage. And now you have hypothyroidism. Well, after a month being reactive, I now know that I need to correct, or the dosage has to be correct in order to get me back on track. That's the reactive care. And finally, the data that I have, most of the time, will focus on the diagnostics, not for prevention. Okay, all of this, let's put them together to this like flywheel, okay? So data, because of the silo data and because of the information blockage, we don't have much in order to do the better model. No better model, no better app, so that the user is not empowered. So the whole flywheel, stop right there. Not to mention that the app may be useful, but just for diagnostics. And also the user has to go out by reactively to seek the help. So that's another reason why this flywheel doesn't fly. What can we do? What can we do about this to correct this? Okay, so we know that the data is the foundation of AI. What if we bring all those data together so that we have a comprehensive personal e-child system just for that patient? Is it good? Oh, no. Hey, if we add also the IoT, Internet of Things, your smartwatch, your cell phone, or maybe even your glucose monitor, your Oura Ring, all these kind of things, we can also bring that in with this information together to become a holistic data view for that person. Not only like that, but when a researcher wants to use my data, she comes, I approve, and she can use it. And better than that, in a privacy way, using federated learning. So traditional AI, you collect all the data in one place, and then you train the model, but by the time you collect all the data, what happened? You already breached the data privacy because you collect the data. Federated learning is actually changed the whole paradigm around. So instead of you share the data with someone else, the model will come in and get trained locally on your device. And that will preserve the data privacy. And then if we put all that together, we see how this data flywheel will be done. So first of all, data will be the comprehensive data from everywhere so that we have the better data. And then the better data trained privately the model to make it a precision model, customized and tailor-made for the user. And this model adaptively improves a smarter app, and then finally proactively empower a cognizant users. And remember, with IoT, we continuously produce more enhanced data, and this cycle come all the way around and round. And don't forget, one more thing here is the user doesn't have to be individual. It can be a hospital, it can be pharmacy, it can be insurance company, it can be anyone who wants the data to produce the benefit. for their community. Now, this is the future healthcare flywheel. And it is possible by Federia. And this new technology, get all the data, doesn't matter is public data or proprietary data. And then it's also get the AI working collaboratively. So the AI model training collaboratively, and we have the personalized prediction for the user. Not only like that, but because of the federated learning, we preserve the privacy and respect the ownership of the data and the model owner. Finally, with the IoT, the real-time data collection is now possible. And guess what? Proactive alert, it's also possible. And this is Federia. And if you don't believe me, feel free to Google it. And I guarantee you will find nothing. Because I just came up with this term. And today is the first day that I share this idea publicly with you. But then I know some of you will say, so what? Cupid, good for you to create some like a fancy tacky word and this kind of crazy idea. But so what? April 22nd, 2021, I got a call from my dad there in Asia that my mom got admitted to hospital because of a stroke. Remember, 2021, we're still in pandemic. Not only international travel is basically not possible, even locally, you need to actually get some permission to drive even locally on highway. So how can I do it and help my parents as a son? Oh, our co-founder, Ferdinand, he is a stroke specialist. I can ask him, can he provide some information or advice for my mom? Of course, he said, sure, Cupid, send me those information. Okay, don't worry. Hey, Dad, Ferdinand said it's okay. Can you please send those information to me so that I can pass it to him, give us some advice? What? Fax number? Why you need a fax number? No, we are talking about CT scan and all the record. How can we really get that kind of fax number and fax all those information over and help my mom? They are crazy. Just tell them they're crazy. Having a healthcare record for a patient is a patient's right.
Hey, Cupid, please calm down, even though you're passionate about this talk. Your heart rate has risen to a dangerous level based on your age and family history. Try to stop and take 10 deep breaths.
Okay. Because everything is connected now, my calendar tells the system I am now talking in this auditorium at this time. And because of my smartwatch, they know my heartbeat is way over the dangerous level. Not to mention the GPS know that I am here, not in the gym on a treadmill. So they give me this advice based on my age and my family record. That is the so what. So my mom can actually get this kind of alert before she admitted to the hospital. So the hospital will not charge us $10 per page just to fax some image over to someone else for diagnosis. This is the proactive way to do this kind of next generation of healthcare. So you may say, Cupid, you are proposing, you're suggesting, you're building an ecosystem so that to connect all the patients and doctors and researcher and healthcare organization together, and then enable the data sharing and machine model learning privately. And the result model can also be pushed back to the user so that at the right time, there will be a private and personalized advice to the users. Is that right? Is that really what you want to talk? You don't sound like that you're proposing a new healthcare system. You sound like you're proposing a new Tom Cruise movie, Mission Impossible. It is so aggressive. How can you achieve that? Well, I did not say that it is easy. That's why it is a healthcare mass shot. Is it challenging? If not, someone else has already done that. Is this risky? Yes, it is risky, but the reward is also high. Is this feasible? It was not feasible, but because of the maturity of AI, because of the availability of IoT, and because of the rising of federated learning, it's no better time than now to do this. When we have so many revolutions before us, we fill a gap. We democratize something. By Vidaria, this new technology, we democratize wisdom. Different than knowledge, wisdom is proactively pushing the warning or suggestion to you because it knows your past, your presence, so that it can suggest something to detour a better future you. And every now and then, I expect people may still call me puppet because of English literacy. But I hope fewer people will die because of health literacy. And more people will become healthier because of Vidaria. And it's not only a mission, and we are not only building a technology, we are building trust. If cancer moonshot requires collaboration, healthcare moonshot, we really need this to work together. So let's nail and get these two down together, shall we? Thank you.